Hanji. So very good afternoon, everybody. I hope all of you are doing well, and I hope all of you are keeping up well in this difficult times of pandemic. And I hope all of your family members and everybody is healthy. Right? So my purpose today is okay. So my purpose today is to give you an idea on how to study radiology, how to actually understand the clinical aspect of radiology. So I got a lot of students sending me messages. Okay, sir, we need to know radiology before we start doing the clinical subjects also, because images are a part and parcel of what we are doing in our routine clinical lives. So let's get on with it. Let's get started. I can see all of you. Yes, I can see all of you. So let's start looking at things. So what I'll do here is I will encourage all of you to see these two things. Okay, so I'm adding a small thing here. So number one thing I want all of you to use is that if you have a workbook with you, please open it. If you don't have a workbook, please do not worry. If you don't have a workbook, do not worry. Okay, then okay, if you do not have a workbook, please use your empty register. Please use your empty notebook to make notes, so that if when you get the workbook or when you see in the app, you can actually correlate the images again later on. So if you have the workbook, please open it. If you do not have it, it's okay. I'm okay with it. Now what I will do here is, to begin with, I'll tell you how the classes will be distributed and what will be the flow of my topics. Today I will start with the topic called as CT scan. Then I will go on to a topic called as MRI. Okay, so my goal for today is I want to be able to finish the concept of CT scan with you, and then I want to teach you how to look at CT of the brain. Then I'll show you different CT technologies, and then I want to start with MRI. Okay. Second thing I want you to do is, after this, I will show you diseases of the brain. Okay. This will be the key. Okay. In the second part, I want you to see, after we have done with CT, MRI, neuroimaging, gradually we will reach to a topic called as chest X-ray. Then I will teach you orthopedic X-rays. Okay. And then I will teach you surgical radiology, which would include things like barium study, IVP, okay, ultrasound abdomen, Doppler, okay, radiotherapy, thyroid scan, nuclear scan. These are the kind of things that I will teach you. And I will even go on to talk about PET scan. So broadly, the class will be divided into these two parts. We will start with CT scan. This is the topic that we will do today. Our today's topic will be CT scan. Okay. Then we will go on to MRI, then brain diseases, then chest X-ray, then orthopedic X-rays. Gradually, we will go on to barium, IVP, ultrasound, Dopplers, PET scan, radiotherapy, nuclear scan. So the reason I want you to know is this class is for both for regular and foundation. Don't worry and don't that get confused here. Radiology is difficult for both regular and foundation. It is just a new subject for everybody. So just relax and try to understand, and just relax and we'll try to find out what we're doing. But the key here is, okay, just give me 1 second. Okay, so just give me 1 second, so that once we are starting, I'll just check your chat box and see if everybody is here. Then I'll get back. Okay. So once I have seen the chat box and I see more or less we have all of you with us. As I'll talk about ultrasound also. Don't worry. When I talk about surgical things, I'll talk about ultrasound, barium, IVP. I'll talk about all those things. Mammography, PET scan. I'll talk about everything. But today my goal is to talk about CT scan. Okay. Now I want to ask you all: how many of you know CT scan is based on which type of radiation? CT scan is based on which type of radiation? Please write down on the notebook or on the workbook, whatever you have, but please start writing. CT scan is based on a radiation called as X-rays. CT scan is based on a radiation called as X-rays. Okay, everybody clear? Yes. So once you are clear with this, that CT scan is based on X-rays, my question to you is, number one, is it safe in pregnancy or not? Is it safe in pregnancy or not? The answer is no. CT scan is contraindicated in pregnancy. So once you start understanding the first question, you start getting a hang of it, that the key here is that sometimes we may not understand how the exam is asking questions. When we talk about radiation exposure, the maximum radiation exposure is with PET CT. So maximum radiation exposure is in PET CT, followed by cardiac CT, followed by abdominal CT, followed by chest CT. Then you have barium enema. Then we have CT brain, then mammography, then chest X-ray. Okay. So this is one of the most important sources of questions that you will always get in your exams. So whenever we say radiation exposure is maximum seen in, or in AIMS they will ask you question, arrange the following in order of radiation exposure. So please keep in mind, PET CT has maximum radiation exposure. Then we have cardiac CT, then abdominal CT, then chest CT, then barium enema, then CT brain, then mammography, then chest X-ray. Okay. Now, once everybody is clear with this, I want you to answer a question from previous NEET PG exam. A lady who is 10 weeks pregnant undergoes a chest X-ray accidentally. What will you advise her? So lady who is 10 weeks pregnant undergoes a chest X-ray. What will you advise her? Anybody now? So now we go back again. So this is the first thing that I'm telling you here. Radiation exposure is maximum in PET CT, then cardiac CT, then abdominal CT, then barium enema, then CT brain, then mammography, then chest X-ray. Okay, so as far as chest X-ray is concerned, it has very minimal radiation exposure. So the question is, if a lady is 10 weeks pregnant, undergoes chest X-ray, what should you do? You need to do nothing. Just continue pregnancy and reassure her. So I'm sure now you are able to get a hang of it. This is the pattern of the exam now. This is our previous NEET PG question. And this is now, they're asking common sense things. They're not asking those rote learning things. They're asking common sense things to you. Now, my question number one is, if CT scan is using X-rays, Then how a X-ray is different from a CT scan? Whenever we do a X-ray of a patient, we are able to see two colors. Whenever we do X-ray of a patient, we are able to see two colors, white, black. Okay. So whenever we do X-ray of a patient, we do white and black, but technically we will use the word opaque and lucent whenever we are doing a X-ray. Okay. So I want everybody to answer that. Please remember, if I see something white on a X-ray, I will call it opaque. If I see something black on a X-ray, I will call it lucent. Okay, everybody clear? Now imagine it here. Why do you think something will appear black on a X-ray, or why something will appear white on a X-ray is based on the attenuation of the tissue. Okay, let's try to understand. Okay, so you can write this in your empty notebook, beta. Empty notebook में लिखेंगे अभी. Then I'll tell you what to use workbook for. Plus, please get the basic right first. Okay, before I start showing you the images, we need to understand what is behind the images, beta. So please see, every tissue has a property called as attenuation. Attenuation means how much X-ray can a tissue stop. Okay. Now imagine, now I want everybody to look at me. Okay. Suppose I'm doing X-ray of my hand. Okay. The bones will stop the X-ray. They will attenuate the X-ray. So they will appear opaque. Anything that is stopping the X-ray will appear white. So that is why bone, your stones in your kidney, they appear white. That is called as opaque. So we use the term radio opaque. And anything that is not stopping the X-ray, like air, will appear lucent. Are you clear? Okay. Now once you're clear, what is a CT scan? The word CT scan stands for computed tomography. That means it is using a computer. So on a computer screen, we have colors like this. Okay. So we have a white color, we have a black color. But in between, we also have a lot of shades of gray. The pun that I'm saying is intended that please see, CT scan has shades of gray. And this is one of the very popular radiology joke here, that I want to make a radiology joke, but there are so many shades of gray that I cannot. So please see here, these are your shades of gray. Now let's imagine again, on a X-ray, okay, I'll explain to you, but don't worry, Kalpana and all, I'll answer your questions, but listen to me first. On a X-ray, a tissue will appear either opaque or lucent, either black or white. On a CT scan, we have more shades of gray to represent the different structures. These shades of gray are based on tissue attenuation, and as somebody has rightly asked, attenuation is dependent on electron density. Okay, attenuation of any tissues, koi bhi tissue, any tissue, how much it can attenuate the X-ray beam is dependent on its electron density. Okay, everybody clear? Okay. Now see an answer. Everybody understand an answer. Okay. It's okay. It's like a joke is not my strength here, but I want you to see my strength is radiology. Please see and understand. Everybody listen to me. Okay. See, on a CT scan, because we are using a computer, we have an ability to demonstrate multiple shades of gray. So there was a man who made the first CT scanner. His name was Hounsfield. First CT scanner was made by a man called as Hounsfield. So Hounsfield, what he did was, I want everybody to listen to me. Hounsfield, he calculated the attenuation of every tissue. He calculated the X-ray stopping power or attenuation of every tissue, and he represented it on a logarithmic scale ranging from -1000 to +1000. In between you have 0, This is called as Hounsfield scale. Okay, you want to know clinical thing, but before you know the basic behind it, you will not be able to see the clinical thing. Trust me, I will tell you everything clinically, but I want you to first understand there was a man called as Hounsfield who made the CT scan. He represented, listen to me, he represented attenuation of all the tissues on a numerical scale ranging from -1000 to +1000. This is called as Hounsfield units. HU. So you might have seen in your CT scan reports, we will write HU. HU is Hounsfield units. Okay. And arbitrarily, he decided water will have a Hounsfield number of 0. So Hounsfield coefficient of water is 0. So anything which can stop X-rays much more than water will be at +1000, which is bone and calcium. And anything which is stopping the X-rays much less than water is air. It will be at -1000. Okay, everybody understands? So I am repeating. I want you to remember these lines. Okay, remember, Hounsfield scale is based on tissue attenuation, which is a property of electron density. It ranges from -1000 to +1000. 0 is water, +1000 is bone or calcium, -1000 is air. Everybody clear? Okay. So we have just made the first diagram. People who are joining a little late, this is the diagram that you're supposed to make. That is it. Okay. Now, once you are clear, everybody, are you clear? Can you now use a little bit of your mathematical correlation? +1000 on visual appearance will appear white, and -1000 will appear black. Are you able to correlate this much at least? On a CT scan, the bone and calcium will now appear white, air will appear black, and the water will have a color in between. Water will have a color in between. So I said HU. HU is Hounsfield units. HU is Hounsfield, that is the name of the scientist. After that, we are using a word units. HU beta, Hounsfield units. Everybody clear? Okay. Now, I'm sure you can see here that a CT scan has an expanded ability to show the shades of gray as compared to X-ray. X-ray may, that capability to demonstrate is less, and a CT has that expanded ability. Everybody understands now? So now at least you know a reason why CT scan can show us more anatomy than a X-ray can do, because it has a wider grayscale. Now, once you are clear with all of this, let's also note down -100 on a CT scan is the attenuation of fat. -100 on a CT scan is the attenuation of fat. Brain tissue, your normal brain tissue, has a attenuation ranging from 20 to 40. Brain hemorrhage has a attenuation of 60 to 70. Everybody clear? Okay. Everybody clear? Okay. I'm zooming it for the people who could not understand. Remember, fat has attenuation less than water but more than air. So we keep it at -100. Brain tissue is at 20 to 40. Brain hemorrhage or a blood clot in the brain will be having an attenuation of 60 to 70 Hounsfield units. Brain hemorrhage will be having an attenuation of 60 to 70 Hounsfield units. Okay, are you clear with this much? Okay, so once you start understanding the basics, now what I will do is I will ask you a question. Okay, I will ask you a question. A child has hematuria. CT scan of the abdomen was done to evaluate him. He has bilateral renal tumors. with a Hounsfield value of minus 100 Hounsfield units, what is the mode of inheritance of the disorder concerned? A, autosomal dominant, autosomal recessive, X-linked dominant, X-linked recessive. Okay. Now, I want you to again see the question, because this is the style of question. This is called as clinical vignette. So the what you radiology I am teaching you, I will give you some fact, but then I will show you how it is asked in the exam. So this child has hematuria, a urinary tract complaint, hematuria is there, and there are kidney tumors, unilateral, bilateral, bilateral. So you know by now, malignancy is a problem of old age. If a child has a tumor, we think of some genetic problem. Especially if it is bilateral, has to have some genetic or some other kind of association. Okay. Now he has bilateral renal tumors, but when we see the Hounsfield value, it is minus 100. Minus 100 is the Hounsfield value for fat. Okay. So fat containing renal tumor is angiomyolipoma, which we will study gradually. Angiomyolipoma. And angiomyolipoma is associated with tuberous sclerosis. And I can see many of you are rightly pointing out tuberous sclerosis has an inheritance of autosomal dominant. The answer is autosomal dominant. So I'm sure gradually you will be able to pick up with me that this is the style of question now. That you will not even know that there is some radiology in the question. It will seem like pathology, but we have a small building block in the question using the Hounsfield scale. Are you clear with this? Are you able to understand the concept? Angiomyolipomas, if bilateral, are strongly associated with autosomal dominant disorder called as tuberous sclerosis. Okay, very good. So once I see all of you are able to understand, I will now quickly switch over to an image, because we have some idea with us. Let's go towards an image. But one more thing to understand is this is how a CT scan machine is. Okay, and this is where your patient is. The X-ray beam are passing through the patient at different angles. While when we do a X-ray beam is going like this. What I want you to see is that I'm sure you can see by architecture, when I do a X-ray, the X-ray beam is going through my body, then it goes and you see it at your back. So this is a two-dimensional test. A CT scan X-ray beam is going all around you. It is a three-dimensional investigation. So if I now repeat, HGE was hemorrhage. Priyanka Agarwal, it was hemorrhage. Okay. And PCKD, some people were saying polycystic kidney disease. Polycystic cyst matlab cyst mein pani hoga beta. Why would it have fat? So that is where people get the questions wrong. That was a pathology question, by the way. So cyst should be a thin walled structure with water. I hope you see the concept here. And HGE was hemorrhage. Okay. Now see. So I'm sure many of you are able to see that CT scan has three-dimensional capabilities. A routine X-ray is two-dimensional. So that is the background that we need to know before we switch over to the image. Let me take you to the first image to look at. Okay, let me take you to the first image to look at. I'm sure many of you can see that this image is a structure in your body called as brain. In brain, this is your anterior aspect, this is your posterior aspect, this is your right side, this is your left side. Okay. So what happens is, whenever we do a CT scan of your body, okay, whenever we do CT scan of our body, the So I hope we are all back here. We had there is a slight thunderstorm going on in Delhi right now. So, the power is little erratic here. But, I'm here back. Don't worry. Don't worry. Okay. So there is a thunderstorm going on in Delhi. So my internet will in between fluctuate. Don't worry. Okay. Okay. So once you're clear. Okay. Okay. So now I am adding to I'm coming back to the same image again. Okay. So this is where we were when we, had a power failure here. So let's see again. So whenever we look at the CT scan of the brain, the top of the image is anterior, the bottom of the image is posterior. Then to the opposite of your right, you will have the right side, and on the other side, you will have the left side. Okay, everybody clear? Okay. So once you get oriented to the right and left, okay, once you get oriented to the right and left, okay, what I want you to do is I want you to quickly look at a image with me. Okay. What I'll do is I'll quickly show you a image here. Okay. Let's see. Okay. So once you know so in radiology, the right and left is always inverted. I will explain it to you better. But before that, please see with me that this is how your brain is actually. So this is your, brain in actuality. In the front, you have the frontal lobe. On the top, you have your parietal lobe. Behind, you have the occipital lobe. Below the occipital lobe, you have the cerebellum. This is the area of your brainstem. Okay. Okay. So I'm sure you can, actually pick it up. Okay. Slight bit of technology. I'm just playing with it, just to, show to you what I'm trying to say. Okay. So that was the medial surface. While on the lateral surface, okay, there will be slight lag here. Don't worry because of the scenario. But just see the brain here. This is your frontal lobe, temporal lobe, and you can see this is the brain. This is the Sylvian fissure in between. That is the Sylvian fissure. Okay. So what I'm doing is I'm just, reducing it now. Okay. Now we come back. Okay. So what I want you to do is please don't panic here. The key that I want, this is a little bit of augmented reality that I showed you in between, just to show you how the brain really feels like. So, it was a bit of a hang there. But don't worry about the hang here. Just get a concept that I'm trying to say here is only this much, that I want all the children to at least know that if this is your brain, बच्चे देखो, if this is your brain, this is what I was trying to teach you. So this is frontal lobe, parietal lobe, temporal lobe, occipital lobe. Below the occipital lobe, you have cerebellum, then you have the pons, you have the brainstem. This is where you have your orbit. Okay. I know, but that was a very heavy software, so it kind of lags. But I just wanted you to have a feel of how the brain really see. So please start. If you type a little bit less, it will be better to understand. So you have frontal lobe, parietal lobe on the top, temporal lobe at the bottom, and like this. Now, once you're clear, beta. Okay. Once you're clear, please see. Okay. I will just check if the internet एक बार check करना है कि नहीं. So now once you're clear, so please see with me. Now once you are oriented with the anatomy, okay, let me just shift my internet here. shifted my internet from my phone to the back to the actual Wi-Fi internet. Just there is a thunderstorm going on. Please hold on. There's a thunderstorm going on. Just have patience. So let's identify the structure here. Identify the structure which is marked as 1. Any one of you can answer? It is orbit. Identify the structure marked as 2. Identify the structure marked as 2. It is sphenoid bone. Okay, it is sphenoid bone. 3. It is lesser wing of sphenoid. Number 4. Let's try to identify, everybody. Please see with me. Number 4 is sella turcica. 5. Temporal lobe. Okay. My question is, why is the number 5, why this number 5 structure is the temporal lobe, why it is not the parietal lobe? Because we are at the level of the orbit. You have to understand, once you start understanding, things will become clear. When we take a section at the level of the orbit, this is the base. So you will have the temporal lobe, because I just now showed you a 3D image where I showed you how the brain actually looks like. Now let's see if you can answer, any one of you. Okay, behind the temporal lobe you have a part of the temporal bone called as the petrous. So I'm making it as number 6 is your petrous part of the temporal bone. Okay, so I want everybody to go with my speed. Don't ask me to go slow or fast. I want you to understand. Please see. So people who do not have the image book, after I will have fully labeled the image, I will tell you to take a picture. Do not take a picture before that. I will tell you when to take a picture. If you don't have a workbook right now, just understand. So please see. So number 1 is the orbit, 2 is the sphenoid bone, 3 is the lesser wing of sphenoid, 4 is sella turcica, 5 is your temporal lobe, 6 is your petrous temporal bone, 7 is the part of your brainstem where you can see the pons. Okay. 8 is the posterior most part here, which is your cerebellum. Everybody gets it? So please see, last year in NEET PG exam, they asked a question, they put an arrow here and they said identify the structure, and the answer was cerebellum. Okay, answer was cerebellum. And many people could not understand is it cerebellum or not, because they could not see the anatomy. This is how the cerebellum is. Please see the anatomy with me. It has 2 cerebellar hemispheres. You have a vermis and you have foliar architecture like this. You have folia like this. So once you see it, you will be able to follow that in your exams, they are not asking you hi-fi questions. They are only asking you simple things like, can you identify cerebellum in the exam or not? So this number 8 is your cerebellum. Okay. So once you understand all this, I will ask you all to identify the structure that I'm labeling as number 9. What is the structure labeled as number 9? Okay. So, Sheikh Mohammed, I hope you see why this is not cerebellum is. Please see the drawing that I have made there, and I explained to you that the foliar architecture is there. The entire shape is like that of a cerebellum. Okay. Now see, please see number 9. Okay. Number 9 is the area which is called as CP angle. Cerebellopontine angle. Now please see, CP angle is the place. Now let's see what is there in your in petrous temporal bone. In the petrous temporal bone, we have the hearing apparatus, which is responsible for hearing and balance. So you have the 8th nerve, and along with it the 7th nerve traversing through this area. Are you clear that from the CP angle you have Okay, you have the 7th, 8th nerve passing through that area. Okay, so for those of you who do not have a workbook and who think that they need an image to look at later on, okay, so this is the image that you need to take a picture at. Okay, this is the picture that you need. Do not take unnecessary images. You will have so many. So this is the only image that you need right now to save. Everybody clear? Rest everything we will make notes. Don't worry. Okay, we will make notes. Is everybody clear on this image? Okay. 7th, 8th nerve complex passes through the, okay, 7th, 8th nerve passes through the internal auditory canal, then goes to the CP angle, and that is the area. Very good. So I can see most of you are able to answer, but this is not the style of the exam in future. In future, the exam will be like this. Okay, let me ask everybody a question. A chronic alcoholic had hyponatremia, which was rapidly corrected. Where will you look for the abnormality on his CT brain? Okay, let me ask you a question again. A chronic alcoholic, okay, chronic alcoholic had hyponatremia, which was rapidly corrected. Okay, where will you see the abnormality on his CT brain? Okay, everybody understands? But if you are unable to take the screenshot, don't worry. The same images that I am showing you are also uploaded in your app in the classroom file section. It is already there. Don't panic. Okay, don't panic. Just see it here and see, and you will see. So we know if you have rapid correction of sodium, sodium should always be corrected gradually. It leads to central pontine myelinolysis. It leads to demyelination in the pons due to rapid changes in the osmotic changes. And so the answer in this question will be number 7. The answer in this question will be number 7, because at number 7 you have pons. And that is the key to the exam skill. Now this is a medicine question, radiology question integrated at the anatomical level. So once you know the anatomy, you will be able to answer it. Everybody gets, yes, you need to answer this, bache. You need to write this. Yes. Beta, why would I tell you a question if it is not going to come in your exam? This will come in your exam and I want you to write it down, beta. Everybody clear? That let me tell you how to write it down. बच्चे देखें, so they will ask you कि भाई how will they frame an integrated question on CT brain with pons in mind? They will create a clinical history of osmotic myelinolysis syndrome that happens in alcoholics if you rapidly correct the sodium levels. Everybody clear? Very good. I can see most of you are clear. Okay, second question, beta. Second question. Anybody would want to answer the next question now? The question is, a patient has herpes simplex viral encephalitis. Encephalitis means, encephalus means the brain, itis means the inflammation. Viral causes leading to brain parenchymal inflammation, and we're looking at herpes simplex virus causing that. Where in the CT brain will you look for abnormality in this case? Everybody clear? I will show you the diseases gradually, beta. Don't run into it. First, understand the anatomy. I will show you everything, beta. Hai na? Quickly. Please see an answer. Many children are running. They don't want to go slow. But the key is in clearly understanding. ऐसे फिर बात नहीं बनेगी. Okay? Herpes encephalitis is predominantly. Now, herpes, what herpes does is, listen to me, everybody. Listen to me. Herpes, okay? Herpes goes through your nose, okay? Then it goes through your nose, through your olfactory nerves, it goes into your olfactory tract. And I'm sure you know, okay, I'm sure you know the sense of olfaction is clearly linked to our emotions. Are you clear with this or not? Have you heard of this before? Okay, when you smell good, you feel good. So, olfactory nerve is linked to emotion. Emotion is linked to limbic system. So that is why herpes virus goes through the nasal route, through the olfactory nerves, and also through the trigeminal nerve. It goes and ultimately it lands up into the limbic system. And so in the image, you can see the number 5 is the temporal lobe. And temporal lobe, we all know, it is a part of the limbic system. So the answer here is number 5. Herpes simplex virus has a temporal lobe predication. Herpes simplex virus has a temporal lobe predication. This is a previous NIMHANS question, and this is what is the theme of today's exam. Now they don't want you to directly ask. They want to give a clinical blanket and ask. Everybody clear? Herpes encephalitis has temporal lobe predominance. Everybody clear? Okay, very good. My next question is, bache, everybody focus on it. Where will you look for a tumor called as vestibular schwannoma in the CT scan? A patient has neurofibromatosis type 2. You are thinking of vestibular schwannoma. Where in the CT brain will you look for it? Anybody? So we will look for the vestibular schwannomas in the CP angle, while the CP angle is at the number 9. CP angle is at the number 9. Everybody clear? Brilliant. So I can see I have a lot of brilliant students here. Okay. So once you are clear with the anatomy and the basics of this section, I also want to give a moment here. Okay, everybody listen to me. On either side of the sella turcica, you have something called as the cavernous sinus. On either side of the sella turcica, we have something called as the cavernous sinus. Medial to it, you have a blood vessel called as internal carotid artery. Medial to the cavernous sinus, we have a blood vessel called as internal carotid artery. Anterior to pons, okay, everybody listen to me. Anterior to pons, you have a blood vessel called as basilar artery. Okay. Anterior to pons, you have a blood vessel called as basilar artery. Everybody clear? Yes, I can see you answer this. Very good. So from the pons, anteriorly, a nerve goes towards the cavernous sinus. In between, you have the Meckel's ganglion there. So this nerve is called as the trigeminal nerve, which is your 5th nerve. Okay. Let me zoom it for you. So this is how you think in radiology. That if I know the sella turcica, on either side of it, you should have the cavernous sinus. Medial to the cavernous sinus, you should have internal carotid artery. Ventral anterior to the pons, you have the basilar artery. And then you need to remember that from the pons, the trigeminal nerve is going anteriorly. It is going towards the cavernous sinus, where you have that Meckel's cave, if you remember from your first prof. Meckel's cave. This is the key here. Okay. Everybody understands. Okay, now. Okay, bache. Let's see if you can answer. Let's see how many of you know anatomy. What is the blood supply of pons? Which artery is going to give blood supply to the pons? Okay, can you guess? Anybody? Blood supply of the pons has to come from the artery which is near it. So this basilar artery will keep giving these pontine branches, which will give blood supply to the pons. Are you clear? Pons is supplied by the basilar artery. Below the pons, you have a structure called as medulla, and medulla is supplied by the vertebral arteries. Always remember, medulla is supplied by the vertebral arteries, pons is supplied by the basilar artery. Everybody clear? Yes, brilliant. Okay. Let's see how many of you can answer this question. I will give you a tough question now to answer. Okay. Just clinical correlations we are doing here, nothing more than that. We already know the concept, but we want to understand clinical radiology. We don't want to know the, that rote learning, X-ray, etc. We want to understand what doctor needs to know better. Please see. Okay. one of the branches of the basilar artery, listen to me, one of the branch of the basilar artery becomes, because of age, it becomes tortuous, and it starts to form a loop on the trigeminal nerve. Suppose in one person, one older person, is any branch of the basilar artery becomes tortuous, and it starts to sit on the root of the trigeminal nerve. Okay, can you understand this now? You have an aberrant vessel, you have an abnormal tortuous vessel sitting on the trigeminal nerve. What will happen? Listen to me, answer. What will happen? The artery will pulsate. When the artery pulsates, the nerve will be compressed and the patient will have sharp shooting pain. That is called as trigeminal neuralgia. I'm sure now you are able to put it, understand. Are you clear with this or not? So blood supply of medulla sanjay, it was vertebral artery, while at the level of pons it becomes basilar artery. Beta देखो अब देखा कि anatomy भूल गए थे ना, and you were thinking that you will read radiology, but I want to see the integration. So that is where in pharmacology they were talking about carbamazepine. Are you clear with this or not? Now do you understand why trigeminal neuralgia happens? You know why it happened in Salman Khan. You saw with age, he's aging, the Botox and everything, but he's aging. So one of the artery becomes tortuous, and that is sitting on the trigeminal root, pulsating, causing shooting pain on the face. Okay. So gradually, when the classes will go on further, I will tell you how we use radiology in treatment also. So once you are clear, okay, are you able to understand this or not? Okay, Vritika. So I hope you see now, बच्चे आपने याद किया हुआ था, याद है ना pharma में drug of choice for trigeminal neuralgia is carbamazepine. You never understood what is happening here. So because basilar artery is giving multiple branches, if one of the branch becomes tortuous and it sits on the trigeminal nerve, it will cause sharp shooting pain in the trigeminal distribution, which is called as trigeminal neuralgia. Everybody clear? Okay, I think most of you are clear. Okay, beta. Now, once you are able to understand the clinical anatomy here, okay, I will do a quick revision. Anji, so just, we have a little patience. We are having a big thunderstorm here, and I think there is a massive, storm happening outside. So just have patience. I am, using the phone internet for the time being, just to, get it back for you. Don't worry. Okay. So whatever we have seen here is, we just saw how the anatomy of the brain converts into integrated MCQs, and we also saw how we could see the questions here. Just to revise, this is your orbit, temporal lobe, sella turcica, pons, cerebellum, CP angle. Okay, so this is what I have taught. Okay. Yes, I think everybody has understood this. So what is Meckel's curve? But I think, whenever you have such a doubt, please go back and check in anatomy also. It's an anatomical term where you have the trigeminal. Okay. So I'm just, getting it out. Everybody gets it? Okay. Now, let's go to the section above it. Okay, beta? Now what I'll do is I will go a section above it. So we were at the first cut. Now I'm going above it. Now, when I put a 1 here, now the 1 is your frontal lobe. Okay. Now, when I go above it, okay, that is your frontal lobe. Okay. Everybody understands? Okay. Now, please see with me and answer. Listen to me, everybody, that in the first section, we could only see the temporal lobe because that is at the inferior part. When I go up, I can start seeing the frontal lobe. Okay, everybody understand? And the second is temporal lobe. Okay, so one is frontal lobe, second is temporal lobe. Okay, you can actually label it with a pencil. That's a good suggestion that somebody has given. It's a good idea, beta. But label just like I am labeling numbers and on this side. Okay. Okay, everybody understands? Number 1 is frontal lobe, 2 is temporal lobe, 3. is pons. Number 3 is pons. Okay. Number 4 is cerebellum. Okay. Is everybody clear? Is everybody able to understand this? Number 1 is frontal lobe. Number 2 is temporal. 3 is pons. 4 is cerebellum. Okay. Okay, beta. Okay. A parietal, I will tell you, bache. Wait. It's ऐसे नहीं होता beta anatomy. You have to wait and give me time. I'll explain every lobe to you. Understand? Okay. Now, once you're clear with this, everybody, I want you to see. Okay. Check. Okay. So the ventricular structure, the CSF filled space that you see between pons and the cerebellum is your fourth ventricle. Okay, the CSF space between your pons and the cerebellum is your fourth ventricle. And I can see some of you are getting confused. And these are the children who do mistakes in the exam also. Beta, please listen to me, beta. ध्यान से देखो, बच्चे देखो ध्यान से. This is your temporal lobe. It is the part of a cerebrum. तो cerebrum में हमें क्या मिलेगा? Gyri sulci. Okay. Okay. So cerebrum में we have gyri and sulci. While in cerebellum, please see the cerebellum, you do not have any gyri sulci. You have foliae. You have this line architecture. So once we understand the basic, you will not do it wrong. Once you understand the basic, you will not do it wrong. Are you clear with this or not? भाई टेम्पोरल लोब में गायरा सल्काएं हैं क्योंकि वो सेरिब्रम का पार्ट है. Cerebellum will have those foliae because it is a different part. Okay. Okay. Everybody gets it? Yes. So I think is the internet back? Now we come to the most important question here. Okay. This is a tough question. Only children who are good at anatomy will be able to answer this better. See, I will make a structure as number 5. Okay, I'm marking number 5 here. You need to think and tell me what is the area marked as number 5 in the CT scan. Okay, what is the area? So so between the pons and the cerebellum, you have your fourth ventricle. Okay, between the pons and the cerebellum, you have the fourth ventricle. So the arrow is marked at the fourth ventricle. That is fourth ventricle, bache. Now listen to me and answer. Any one of you can answer. What is the area? Number 5 is the area where your fears are located. जहां पे आपका डर है. Okay. Number 5 is the area where you have your fear. So when you see now, and you can see in front of you, and that is the key here, and this is a typical radiology physiology integration. That area is an almond shaped structure in the temporal lobe called as amygdala. Okay, everybody understands? So how will you localize amygdala? To locate amygdala, we will see the temporal lobe. If this is your temporal lobe, amygdala is located medial to it. So it is medial to it and anterior. This is where you have the amygdala. Are you clear with this or not? भाई temporal lobe को ढूंढेंगे, medially आएंगे, anteriorly you will be able to find the amygdala. Everybody clear? Amygdala is seen in the mesial temporal lobe, anteriorly located. This is amygdala. Okay. And this is a classic question which they keep asking even when you appear for USMLE exams. This is how they will ask you in step 1. And many people will get it wrong because they will know physiology, but they will not know anatomy. They may know anatomy, they may not know radiology. So you get stuck somewhere or the other. Okay. Now let's see an answer, everybody. If I may ask you now, What part of the ventricular system is present in the temporal lobe? In the temporal lobe, you have the inferior horn of the lateral ventricle. In the temporal lobe, you have the inferior horn of the lateral ventricle. Everybody understands? So what happens is amygdala is anterior to the inferior horn of the lateral ventricle in the temporal lobe. Okay, let's see, anybody can answer now. What is the area marked as 6? What is the area marked as 6? 6 is the part of the temporal lobe which is most medial. Sixth is the part of the mesial temporal lobe which is most medial. So the most medial structure here is number 6 is, anybody? Number 6 is uncus. Number 6 is uncus. So you remember this uncus, it will be very helpful to us, and I'll make sure that you understand the clinics when you do the anatomy with me. Please see, everybody, yes, I am so happy that so many of you are so intelligent. I'm so happy to see you. And please see now, let's see now if you can identify the area marked as number 7. Area marked as number 7 is the part of mesial temporal lobe located posterior to the inferior horn. इंफीरियर हॉर्न के पीछे, टेम्पोरल लोब के मीडियल पार्ट पे पीछे की तरफ, नंबर 7 पोस्टीरियरली लोकेटेड. व्हाट वुड बी नंबर 7? सो नंबर 7 हियर इज हिप्पोकैम्पस. Number 7 here is hippocampus. Are you clear here with me or not? Yes, you can now see. So we can now see in the temporal lobe, in the medial part, which is popularly called as the mesial part, आगे की तरफ anteriorly amygdala, medially uncus, posteriorly hippocampus. Everybody understands the concept? Yes. Okay. Now let me tease you with anatomy. This is where you have your internal carotid artery. Okay, I'm increasing the size so that everybody can see. This is where you have your internal carotid artery. Internal carotid artery gives rise to a branch which gives rise to the blood supply to the hippocampus. Internal carotid artery, 7 number, Divija Desai, 7 number is hippocampus. Okay, 7 जो है हिपोकैम्पस है बच्चे, जो टेम्पोरल लोब में मीडियल तरफ पे पीछे की तरफ है. Okay. Okay, Devija. Okay, everybody now, let's see if you can answer. Better tell me, name a branch arising from the internal carotid artery which gives blood supply to the hippocampus. Now can you see, you thought that you know anatomy and you're coming to learn radiology. I am telling you, you don't know anatomy here. We need to learn the clinical anatomy first. Hippocampus is supplied by a branch of internal carotid artery called as anterior choroidal artery. Okay, hippocampus is supplied by, okay beta, Purna, everybody is getting it wrong beta. Hippocampus is supplied by a branch of internal carotid artery called as anterior choroidal artery. So if I see clinically, now try and understand why I know all this. Clinically, if I see a patient with an infarct in hippocampus, I know this is the anterior choroidal artery territory infarct. Okay, so you understand now, to become a good clinician, you need to have those basics with you. Otherwise, you will have a constant life of struggle. Okay, everybody understands? Yes, I can see now most of you are able to answer this. Second question now. So are you enjoying it now? Okay, I told you that I will tell you all integrated thing, but have patience because I have to build it from basics, because the children today, they don't know the basics and they want to go straight away to clinics. Okay, now let's see if you can answer better. What is the CSF space? What is the CSF space which is located anterior to the pons, posterior to the frontal lobes, medial to the temporal lobe. Can you see the star-shaped CSF space here? Can you see a CSF space? Okay. Okay, just one more answer and then you can take the picture, beta. One more anatomical structure, then you can take the picture, beta. Hai na? Okay. Okay. I'm answering, beta. Listen to me. Can you see a CSF space that I have shaded, which is star-shaped, anterior to the pons? It is anterior to the pons, posterior to the frontal lobe. This area I am now labeling as number 8 is called as suprasellar cistern. Number 8 is your suprasellar cistern. That is not third ventricle, बच्चे. Third ventricle ऐसा नहीं होता बेटा. Third ventricle एक slit like space होगा बच्चों, जो कि थैलामस, दोनों तरफ थैलामस होगा तब बोलेंगे बेटा. यहाँ थैलामस था ही नहीं, है ना? So are you clear with this or not? This is called as suprasellar cistern. Third ventricle is seen when you see the thalamus, not right, है ना? अभी तो temporal lobe और frontal lobe और pons देख रहे हैं. This is not the level of the third ventricle. This is suprasellar cistern. Everybody clear? I will show you third ventricle later on, and then you will be clear. Okay. Okay. Let's wait for it. And I can see some of you are getting confused and all that stuff. But let's see if you can answer. So some of you wanted to take a picture. This is the picture that you need to take. Okay. This is the picture you need to take. This one. Okay. This one. This is the important one. Okay. Nothing else. Everybody clear? Okay. Now, once you are clear, okay. So once you're clear with this, okay. Yes, Avni Kothari, yes, that you remember, that was correct. In the temporal lobe between 5, 6, 7, we saw that CSF space, that was the inferior horn of the lateral ventricle. Clear. Now, this is the anatomy that we needed to know. But the key here is we need to know how the clinical question will be structured. So I'm removing everything. Okay, I am sure you had taken a picture. I'm removing it. I'm cleaning up my slate. I'll create some clinical questions for you. Okay, I'm changing the numbering a little bit just to make you a little confused. Like that. Okay. So now I will give you a question. Let's see if you can answer. Okay. Look at the image and say, out of the CT image shown to you, where will you look for changes of Alzheimer's dementia earliest? Okay. Out of the CT image shown to you, where will you look for changes of Alzheimer's dementia earliest? Okay, everybody. So we all know by now, Alzheimer's dementia begins with hippocampal atrophy. बेटा यू विल बी गेटिंग दिस वीडियो ऑल्सो बेटा, आप दोबारा भी देख सकते हैं. क्यों घबरा रहे हैं, ना? समझने की कोशिश करो बेटा. ऐसे तो वो फोटो तो आप इकट्ठे करते करते यू हैव बीन डूइंग इट फ्रॉम कॉलेज ईयर्स, है ना? सो प्लीज सी एंड अंडरस्टैंड. सो Alzheimer's dementia begins with, listen to me, hippocampal atrophy. So where is the hippocampus in this image now? Number 4. So this is how they make questions in the exam. They might actually say a lady comes with her mother. The mother is now not able to remember her name. She's forgetting where she keeps her keys, car keys, and she's having cognitive decline. And you're thinking of Alzheimer's dementia. Where will you see the changes on a MRI or a CT? First, you'll see it in hippocampus. The answer is 4. And the classic lobes which are atrophied later on in Alzheimer's dementia are temporoparietal. This is the most important pattern. Radiologically, Alzheimer's dementia will begin with hippocampal atrophy, but then it will progress on to temporal lobe and parietal lobe atrophy. Remember this, temporoparietal atrophy. I changed the numbers, Ritika, to make you confused there. Okay, that was the entire idea. Sometimes in exams also they do such things. Okay, yes. Are you clear? Everybody sees the section now. We are going from below upwards, Rushipita. We're going from below upwards. Yes, everybody understands. Now, let me ask you a question. Now, if I ask you, this is where we saw the internal carotid artery. Let me draw it for you. This is where we saw the internal carotid artery. Internal carotid artery gives a branch which goes between the frontal and the temporal lobe towards the lateral surface of the brain. Okay, so see, understand, ब्रेन में फ्रॉम द इनर साइड एक ब्रांच है इंटरनल कैरोटिड आर्टरी की जो ब्रेन के लैटरल सरफेस की तरफ जा रही है. ओके, दैट ब्रांच इज कॉल्ड एज द मिडल सेरिब्रल आर्टरी. Okay, that branch is called as the middle cerebral artery. And internal carotid artery gives a branch which goes anteriorly in the midline. एक ऐसी ब्रांच जो anteriorly जा रही है midline में, we will call it anterior cerebral artery. Are you clear? But I will show you diseases. Abhi, I told you, I'm not telling you diseases. I'm only telling you the anatomy first. How to look at a CT. I will show you diseases, but don't worry. You have a big number of cases to look at. We'll be able to do everything. Okay. I will show you these things. But this is where you have the middle cerebral artery and the anterior cerebral artery. Okay. Are you clear? Anterior आगे की तरफ midline में होती है. Middle is going towards the lateral surface of the brain. And this is where I want everybody to understand, this is where you have the basilar artery. Basilar artery is present anterior to pons. Okay. Okay, everybody, I will take you to the Ames level here. Let's see if you can answer. This is where you have the pontine branches supplying the pons. This structure is the uncus. The medial most part of the temporal lobe is the uncus. Okay. Now my question to you is this. Everybody now, anybody who is at the Ames level and who has done surgery पढ़ लिया, head injury पढ़ लिया, वो कोशिश करेगा बताने की. Let's see if you can answer. In uncal herniation, if the uncus herniates, I will explain to you why it herniates. If the uncus herniates, in any case, the uncus would herniate in this direction. When the uncus herniates at the level of the pons, I will tell you everything, but wait. When the uncus herniates in this direction, it ruptures the pontine branches of the basilar artery. It ruptures the pontine branches of basilar artery, leading to a pontine hemorrhage. So I'm writing it in full. Some people will get confused. Are you clear, बच्चे के नहीं? अगर uncus herniate करता है, it may rupture the pontine branches of the basilar artery, leading to hemorrhage in the pons. And if you see this, it indicates poor prognosis in a patient with uncal herniation. This is described by Dr. Durrett, and hence we call it as Durett's hemorrhage. This is what you will read in surgery, but I wanted to make sure that you see the sense here that uncus, when it herniates, it may, if it herniates to a much severe level, it may tear the pontine branches of the basilar artery, leading to Durett's hemorrhage, which some of the students have been able to answer already. But are you clear? And this would indicate poor prognosis. But some of you are unable to understand what is happening. Let me explain to you. Listen to me. Suppose this is your dura. Okay. And in dura, you have folds like these, which are called as the tentorium. And this is where you have the falx cerebri. Okay. This is where you have the frontal lobe. This is where you have the temporal lobe. This is uncus. Okay. Okay, let me zoom it, beta. Let me zoom it. Okay. So this is your, this coronal. If I take a coronal section of the dura mater, you have a midline fold called as the falx cerebri, and you have a tent-like fold called as the tentorium. Okay, bachcho? So if suppose you have a hemorrhage sitting here, if you have a brain hemorrhage sitting here, what will happen? This hemorrhage will push the brain and it will push the uncus through and below the tentorium like this. This is called as transtentorial herniation, or we may say uncal herniation. This is called as transtentorial herniation. बेटा बच्चे अगर स्पेस नहीं है बेटा you can write in the notebook है ना, right? Open your notebook and start writing. So please see, this is the importance of it. Okay beta, I am trying to give you the reason why I am telling you the ankas. Now if you can understand a little bit about anatomy, this is where you have the midbrain and this is where you have the pons. So uncus, when it herniates, it compresses the midbrain. Then if it is reaching till the pons and it ruptures the pontine branches of the basilar artery, you will have a hemorrhage called as Duret's hemorrhage, which indicates poor prognosis. Everybody understands? Are you clear? Yes? So are you able to understand a little bit here that uncus is the medial most part of the temporal lobe which herniates in transtentorial herniation. Everybody follows? Yes? So, yes. Okay. So, you have been hearing all this. I just wanted you to see the anatomical perspective here. Okay. Everybody now listen to me. I'm removing the structures here. I'm cleaning up the image. In the suprasellar cistern, in the middle of it, I'm making a dot. In the suprasellar cistern, in the center of it, I am making a dot. Okay. This dot indicates your pituitary infundibulum. Okay. Everybody, are you able to follow me? Pituitary stalk, beta, infundibulum is located in the center of the suprasellar cistern. Sella के ऊपर तो हम बोलेंगे suprasellar. So above the sella, we will call it as suprasellar. You have the pituitary stalk in the suprasellar cistern. Okay. Now, suppose during development, I'm sure some of you would be aware of it, pituitary develops from two sources. There is a pharyngeal part which forms the Rathke's pouch, and there is a cerebral part which comes from the diencephalon. So, there is a pharyngeal pouch during pituitary development which is called as Rathke's pouch. बच्चे सोच के बताना है. Suppose Rathke's pouch remnant by mistake is left behind in your infundibulum. भाई गलती से Rathke's pouch का tissue infundibulum में रह गया. It is a mistake that has happened. If by mistake Rathke's pouch tissue, okay, then what will happen? It might grow into a tumor. It might grow into a tumor. Can you name that tumor for me? Which tumor is found in the suprasellar cistern, which is known to arise from the Rathke's pouch remnant from in the pituitary infundibulum? What do you call it? That is called as craniopharyngioma. Okay, and you might have read this in your pathology as well. Craniopharyngioma is a Rathke pouch remnant tumor. And last year in the NEET PG exam, you had an image similar to what I'm showing you here, and you had to identify craniopharyngioma. I'll show you later on how it really looks like. बट बच्चे अगर एनाटॉमी नहीं पता होगी ना तो फिर बहुत मुश्किल होगी. एक बार बेसिक्स बनाएंगे, it will help us a lot in later on. Otherwise what will happen is I will keep speaking, you will not be able to know अंकस क्या अंकस है ना. So that's why we need to understand the basics. Are you clear? Everybody understands this? Very good. So I can see most of you are able to understand so somebody was asking na, why do we need to know about suprasellar cistern? Because that is the place where you look for craniopharyngioma. Very good, beta. Very good. I can see most of you are able to answer. Okay. So I have given you an idea on amygdala, uncus, hippocampus, pons, suprasellar cistern, and we've talked about a branch which everybody forgets, an artery called as anterior choroidal artery, which supplies the hippocampus. है ना? चलिए बच्चे आगे आते हैं. So now I am going upwards. Okay. Below upwards, I am going in the brain. And now you can see the area marked as 1 is frontal lobe. Area marked as 1 is frontal lobe. Area marked as 2 is temporal lobe. Okay, बच्चे देख पा रहे हैं? Everybody clear? Now, can you identify the demarcation between them? Can you see this large sulcus? Can you see this large sulcus which is demarcating the frontal lobe from the temporal lobe? Any one of you can answer. है ना बच्चे ये क्या चीज है ये कौन सा सल्कस है which is जिसके आगे frontal है पीछे temporal है I showed you with that augmented reality image also. What is this? That is your Sylvian fissure. Anything else you can call it? We can call it as lateral sulcus. You can call it as the lateral sulcus or the Sylvian fissure. Okay? Yes. Everybody clear? Now, can you recall? Any one of you can recall? बच्चे किसी को याद है? Do you remember this or not? Okay, we told you that the middle cerebral artery कौन सी थी बच्चों? MCA वाली है ना? Middle cerebral artery from the internal carotid artery goes towards the Sylvian fissure. Middle cerebral artery Sylvian fissure की तरफ जा रही है ना? अब Sylvian fissure में जाके when that reaches there, it gives a superior branch and an inferior branch. Okay, middle cerebral artery has a superior branch and an inferior branch. Okay, now the understanding that I wanted you to build up, and this is the kind of thing that I want you to understand. If you have an infarct here, okay, if you have an infarct here, that means it is involving the inferior branch of the MCA. Okay, if you see an infarct here, that is the inferior branch of the MCA, and if it is here, that is the superior branch of the MCA. Are you clear? Okay, so that is the key here. Now let's see here. This is 1, this is 2. Everybody clear? 1 is frontal lobe, 2 is temporal lobe, 3 is occipital lobe. You can start to see a little bit of occipital lobe, but बच्चे देखो, don't get confused, but I am outlining the tentorium here. In the center, you can still see cerebellum, and you can see the superior part of the cerebellum. This is the superior part of the cerebellum here. Okay, beta, even Vasik, even if you are unable to take the image, this video is going to be with you, beta, and you can later on label it. So there's no point. This video is with you. Okay, don't worry. I will get it uploaded for you. Okay. See, are you clear with this or not? So this is cerebellum. Can you see it here? That in the middle, you can still see the superior part of the cerebellum, which is actually, if you remember, the superior part of the cerebellum is supplied by the superior cerebellar artery, which is a branch of basilar artery. So this is the cerebellum here. Everybody clear? Everybody clear? Yes. And so what is tentorium? Let me explain to you. So if you remember, this is how in anatomy they used to draw the cerebellum. है ना, सेरिबेलम ऐसा होता था ना, याद है ना, और उसके ऊपर बच्चे याद है कि ऐसे एक ड्यूरा का फोल्ड होता था, ड्यूरल फोल्ड कॉल्ड एज tentorium. So the section that you're looking at is actually like this. Okay, so I'm repeating for you. See, this is your cerebellum. The green things are your tentorium. Okay, so it is shaped like a tent, like this. So that's why we call it tentorium. It's a dural fold. It is the fold of dura mater that you might have studied in your first prof, but if you have not, it's okay. Just understand with me, tentorium. So when I'm taking a section, so it is passing through the tentorium, it is cutting the tentorium, and you can see the cerebellum in the middle. Okay, and in between, I said that middle cerebral artery has a superior branch which goes towards this area, towards the frontal lobe, and an inferior branch which goes towards the temporal lobe. Are you clear? Okay, let's see if you are able to understand this. Okay, very good. Okay, so 3 is your, everybody understand, 3 is your occipital lobe, but if they say 4, that is cerebellum. Okay, everybody now try and understand and answer with me. What structure do you think is this? Okay, this is a previous 2019 NEET exam question that I'm now showing you. Name the structure highlighted by for you in the with the yellow color. What could be the structure that I'm trying to highlight for you? Okay, beta ji bataएं. That is your, anybody? That is your midbrain. So above the pons, when we go above the pons, we see a heart-shaped structure like this, which is your midbrain. Very good. So what happens is, बच्चे आपको लग रहा होता है that you are feeling that in the exam you need to know hi-fi things and get Nobel Prize, but actually speaking in the exam बच्चे cerebellum, midbrain, pons ही नहीं बता पा रहे होते. Okay, are you clear or not? In the real exam, most people they struggle at the basics, not at the hi-fi things. They feel that they need to know the hi-fi things, but actually speaking, they get basics wrong. Are you clear? Very good. So if I draw the diagram of the midbrain on the side to make sure that you understand. Okay, anatomically, the midbrain that you see here is like this. Okay, everybody clear? So anteriorly in the midbrain, this is called as crus cerebri, or in English we can say cerebral peduncle. बच्चे लिख लो cerebral peduncle. Okay, so I'm not going towards any exam pattern. I'm telling you what you need to know in CT brain, and I'm telling you this would help you everywhere. Any exam, any clinics, this is the key. So this is crus cerebri, and this is the dorsal part, which is called as the tectum. Tectum, where we have the colliculi, superior colliculi, inferior colliculi. Everybody clear? Behind in the crus cerebri, बच्चे ध्यान से देखें, in the crus cerebri, this is where you have your corticospinal tracts going through. Okay, this is where you have your pyramidal tracts going through the crus cerebri. Behind it, you have a black substance. Is called as substantia nigra. Behind it, you have a black area called as substantia nigra. Okay, that is a slight. Okay, don't get me wrong, beta. थोड़ा drawing में गलती हो गया मेरा, बराबर कर देते हैं. Some of you getting confused now. Are you clear now? Okay, so in the midbrain, anteriorly you have the crus cerebri, posteriorly you have the colliculi. This is opposite to how anatomy people will make the diagram. In anatomy, they always make dorsum on the top, ventral at the bottom. In radiology, anterior is at the top, posterior is at the bottom. Are you clear? So are you clear with this? So behind the substantia nigra, we have a red colored nucleus here, which is called as the red nucleus. Okay. Behind the substantia nigra, you have the red nucleus. And this is where you also have the, if somebody remembers, the oculomotor nerve. This is where you have the oculomotor nerve nucleus. Everybody clear? Are you clear with this? Everybody understands? Okay. बच्चे देखिए, I would always recommend if I am drawing something, please draw it. बच्चे बाद में आपको नहीं याद रहता ना बेटा, just draw it. Okay, मैं बना रहा हूँ, मैं भी तो घर से नहीं बना के लाया ना, मैं बना रहा हूँ. So please make it with me, okay, everybody? Okay, yes. So don't be like कि ये लिखना है कि नहीं लिखना. If I am writing something, you need to write it, बेटा, because if I am, मैं भी तो घर से PPT लेके आता ना. Okay. Okay, everybody now understand. This is how the midbrain is structured anatomically. So you have the substantia nigra, you have the red nucleus, you have the oculomotor nucleus giving rise to the third nerve here. Everybody clear? Okay. Now we go back to the anatomy here. So what happens in a CT scan is, let me increase the size, number 5. So number 5 is your midbrain. Number 5 is your midbrain. Now see, I'm going to make a diagram and make you understand. Just understand it with me here. This is where you have the crus cerebri. This is where you have the crus cerebri. Crus cerebri, where you have the corticospinal tract, the pyramidal tracts. And this is where, okay, bache, this is where you have the substantia nigra. Okay, this is where you have the substantia nigra. Okay. Okay, Rachana is funny. Okay, anybody. Substantia nigra. Name the disease that I'm trying to tell you here. Which disease is associated with this that structure that I made for you? Okay, that is the Parkinson's. So Parkinson's disease, whenever they want to ask you integrated question, they will make a picture like this and ask you what disease affects the area shown to you in the image, and the area shown to you in the image is substantia nigra. Substantia nigra, and that is where you have Parkinson's. Very good, very good. And but some people were getting confused. Behind the substantia nigra, you have the area of the red nucleus. Okay, very good. Now see, and this is a typical question. This has been asked in names also multiple times. Simple correlation. भाई बच्चे पता तो होना पड़ेगा ना कि substantia nigra देखना तो mid brain में देखना है. Behind the crus cerebri you will find the substantia nigra. Very good, beta. Now let's see if you can answer this. Okay, if these are your crus cerebri, crus cerebri मतलब cerebral peduncle, can you see a CSF space anterior to the crus cerebri, which is bounded anteriorly by the optic tracts? आगे ऑप्टिक ट्रैक्ट है और पीछे सेरिब्रल पेडंकल है. Can you see a CSF space? Okay, can you see a CSF space between the optic tracts and the cerebral peduncles? Okay, can you call that? What do you think the space is? This space that I'm marking with a star is called as interpeduncular, माने दो peduncle के बीच में interpeduncular fossa cistern. Are you clear now? So now you see here that the problem is that you know so much, but when it comes to clinical images, it is not only you, even I see MD residents also keep struggling because nobody is spending time in basics. Everybody wants कि sir बीमारी दिखाओ, disease दिखाओ. अभी करेंगे ना. Let's first understand the anatomy now. I'm again telling you, please see beta, at the level of midbrain, now this is the midbrain. अभी CP angle नहीं दिखेगा. CP angle pons के level पे था. At the level of midbrain, anterior to the midbrain, okay bachcho, anterior to the midbrain, you have this rhomboidal shaped CSF cistern which is bounded anteriorly by the optic tracts. It is called as the interpeduncular fossa cistern. Okay, interpeduncular fossa cistern, and this is where you have a structure called as the, anybody remembers what do you see there? If you see the interpeduncular fossa, oh, midbrain के आगे, what two things you see there? You see the mammillary bodies. This is where you have the mammillary bodies. So where will you look for mammillary bodies? You will look for mammillary bodies anterior to the midbrain. जहां midbrain दिखेगा, उसके आगे दिखेगा mammillary body. And you must have read about this in your, in anatomy also, when they were teaching you circle of Willis. उन्होंने बोला interpeduncular fossa में you will have the circle of Willis. Are you clear? Okay, very good. So before I tell you more things, let us do a clinical question first, and then I'll come back. Okay, I'm removing the labeling that I've done so far. I'm cleaning up the slate so that we can understand a concept. बच्चों, है ना? पढ़ के देखते हैं बेटा, है ना? बच्चे देखो, मैं ये कह रहा हूं, याद तो बहुत कर लिया यार. लेट्स अंडरस्टैंड, समझ के देखते हैं. यू विल एंजॉय मेडिसिन, नहीं तो मजा ही नहीं आएगा. आपने बताना बेटा. अ क्रॉनिक अल्कोहलिक, okay, comes to you with acute onset confusional state along with ataxia and ophthalmoplegia. What structure that I have just shown you will be involved in this disease, and what is the cause of that happening? ठीक है, क्वेश्चन समझ आया? एक क्रॉनिक अल्कोहलिक है बच्चे जिसको acute onset confusion हो गया है, ataxia of thalmoplegia. Where will you see the problem? So this is the classic clinical presentation of a vitamin deficiency called as Wernicke's encephalopathy. You remember this? पढ़ा था? Wernicke's encephalopathy is due to deficiency of thiamine. So you know by now, a chronic alcoholic, okay, would have been ignoring his nutrition because he's taking empty calories with the alcohol, he's taking so much calories, he's ignoring his nutrition, he's ignoring the micronutrients. And in India, many alcoholics also are not having that kind of financial status. So they develop thiamine deficiency. The classic clinical triad is confusion, ataxia of thalmoplegia. And the part which is characteristically involved in radiological imaging is mammillary body. Okay. There can be more areas of involvement, but mammillary body involvement is typically seen in Wernicke's encephalopathy. Very good. And I can see that most of you are able to answer this. Okay. Do you want to solve a AIMS level question? Do you want to solve a top level question now that once you've understood a little bit anatomy? Let's go further. This is where you have the top of the basilar artery. This is where you have the top of the basilar artery. So basilar artery, but you listen to me, everybody, wake up, listen to me. Two vertebral arteries at the level of medulla are going at the level of pons, they join to form the basilar artery. And basilar artery in the interpeduncular fossa terminates, and it terminates into terminal branches called as posterior cerebral arteries. Are you aware of this? Basilar artery, the terminal branches of basilar artery in the interpeduncular fossa are the posterior cerebral artery. Everybody clear? Okay. Now I am going to give you a question and you have to tell me the reason. Okay, बेटा, मैं क्वेश्चन पूछूंगा, आप लोगों ने मुझे आंसर बताना है, ठीक है? क्वेश्चन है assertion. Patients with uncal herniation can have blindness. If yes, what could be the reason behind it? Everybody understands? So what happens here is, listen to me and answer. Assertion is, this is the AIMS pattern where some children were asking, sir, AIMS का बताओ ना. अरे बच्चे, basic से तो AIMS में पहुंचेंगे ना, ऐसे थोड़ी. Okay, assertion reasoning pattern is, okay, uncal herniation can lead to blindness. Yes or no? If yes, then tell me why. Okay, uncal herniation में blindness हो सकता है, अगर हाँ तो क्यों? Anybody? Now see here, if this is your temporal lobe, and I'm sure many of you will be able to now gradually appreciate, if this is your temporal lobe, this is the area of the uncus. So when the uncus herniates, it will compress the midbrain, it will compress the crus cerebri. Crus cerebri को compress करेगा तो motor weakness होगा. But in between the crus cerebri and the uncus, you have the posterior cerebral artery. Posterior cerebral artery, if you remember, बच्चे को याद होगा, posterior cerebral artery, okay, do you remember, is going to supply your visual cortex. So PCA compression होगा. But the area of the area in your brain which is responsible for macular vision is supplied by both MCA and PCA. तो वो वाला area बच जाएगा. So remember this. So in uncal herniation, third nerve से बेटा blindness नहीं होती बेटा, third nerve से नहीं होती blindness. Don't get confused. So blindness in uncal herniation is happening because of PCA getting compressed, leading to infarction of the visual cortex. But the macular area is spared, which is supplied by MCA and PCA both. Yes, very good. I can see most of you are able to answer. Very good. So, but I hope you can see now that the entire idea is clinical. The idea is not about कि मैंने थोड़ा सा रेडियोलॉजी में याद कर लिया, एक्सरे वाइट ब्लैक नहीं, उससे नहीं मजा आएगा. We need to understand what is happening here. Okay, everybody clear? Okay. Now, are you ready for an anatomy question again? What is the blood supply of midbrain? Okay. What is the blood supply of the midbrain? Now we remember, I told you, bache, if you remember, I told you, medulla is supplied by the vertebral arteries. Pons is supplied by the basilar artery. What about midbrain? What about midbrain? Predominant supply of midbrain is via the posterior cerebral artery. Midbrain की supply PCA से होगी, because you remember PCA was surrounding the midbrain, so midbrain will be supplied primarily by the posterior cerebral artery. Are you clear or not? समझ आया बच्चे की नहीं? And also you remember, this is the critical thing to understand. This is where you have your midbrain, okay, and this around this you have the PCA like this. Everybody clear? Assertion true था ना बेटा? I told you ना that uncal herniation can lead to blindness. That was correct. It can lead to blindness. Yes. Yes, correct. Okay, but macula is spared. Okay, now understand this and answer. Let's see if you can answer. Let's see if you can answer. I will give you more questions, but to do that, let's revise. Okay. Okay, this is frontal lobe. Between the two frontal lobes, can you see this white line here? That is your falx cerebri. Can you see this white dural fold between the two frontal lobes? That is your falx cerebri. Okay. Now this is your temporal lobe. This is the area of the sylvian fissure, midbrain, uncus, interpeduncular fossa. Okay. Cerebellum. Okay. So what I want you to do is, I just want you to look at the picture in front of you. आगे की तरफ frontal lobe है, पीछे टेम्पोरल, उसके पीछे ऑक्सीपिटल लोब, थोड़ा सा सेरिबेलम का सुपीरियर पार्ट दिख रहा है हमें. We can see the midbrain. Anterior to midbrain, you can see the interpeduncular fossa. IPF is interpeduncular fossa, bache, and you can see the uncus. Okay. Everybody clear? Okay. So this was the anatomy on this section. Okay, we can understand. So we call it cortical blindness with macular sparing happens in uncal herniation. Now, once you are clear, let's go up. And now I'm going upwards. Can you see at every section, I'm trying to go up and up and up. Okay, now see an answer. So you could have taken this image if you want to. That is okay. We have shown you this image multiple times. Now I'm going upwards. Okay, now when I go up, you can still see the frontal lobe, temporal lobe, occipital lobe. Only a little bit of cerebellum is visible. Can you see now? You can see the frontal lobe, temporal lobe, occipital lobe. Only a little bit of cerebellum is seen. Okay. Okay. Suppose this is your shape of your cerebellum. You can imagine now, if I'm taking a section here now, I am sure, बच्चे मैं सोचता हूँ आप जरूर बता पाएंगे. I am sure, अभी I'll tell you better, don't worry. But can you see it? As I'm going above, cerebellum पहले मुझे पूरा दिख रहा था, फिर सिर्फ center में दिख रहा है. The reason is the cerebellum has a shape like this. So when I'm going from below upwards, now I can only see a little bit of cerebellum in the center, जहाँ foliae दिख रहे हैं. Okay, that is the reason here. Are you clear here with this or not? Okay, so I'm just giving you the basic outline here. Frontal lobe, temporal lobe, occipital lobe. Now, can you tell me, any of you can tell me, can you see this large sulcus here, large fissure between the frontal and the temporal lobe where your middle cerebral artery is dividing? That is your sylvian fissure. Okay, everybody gets it? Everybody understands? Okay, yes. Now, once you are clear that this is the area of the cerebellum, Okay, everybody sees? Okay, now I will show you the anatomy that I wanted you to understand. That is slightly difficult, but please bear with me. Area that you see here, which I'm marking with my dots, is your colliculi. The area that I'm marking for you now is your superior colliculi. Okay? Everybody understands? Okay. And I can see somebody has asked a question about falx cerebri. I can let me repeat it again. बच्चे देखो ये जो bony projection दिख रही है ना आपको, that bony projection is called as in anatomy जो skull में दिखाया था उन्होंने, that is called as crista galli. But see behind it, can you see this crista galli brain के अंदर यहाँ तक थोड़ी आएगा. This is falx. Okay, let me zoom it for you to see it here. Are you clear, bache? Okay, so you can see the falx cerebri, you can see the crista galli, you can see the colliculi. Okay, everybody clear? Yes. Okay. Now, so बच्चे don't go with the timing and all ना बच्चे हम पूरा topic पढ़ेंगे हम time के ऊपर नहीं सोचेंगे we'll be studying together, don't worry about it. Okay, just don't keep looking at the time and don't be that kind of person, है ना. टाइम तो बेटा वो लोग देखते हैं ना जो कॉलेज में एकेडमिक सेक्शन में बैठे होते हैं, वो टाइम देखते रहते हैं 4 बजेंगे घर जाएंगे, ऐसा थोड़ी है. हम तो डॉक्टर बन रहे हैं ना बच्चे, हम थोड़ी टाइम देखते हैं बेटा. व्हाट इज दिस? So in the midbrain, I am sure you can see the superior colliculi. Are you able to appreciate in the midbrain? I have marked with a yellow arrow a small black colored, dark colored structure, a duct with CSF, pani se bhari duct. Anybody can tell me what could that be? That is called as the aqueduct of Sylvius. That is called as the aqueduct of Sylvius. Now I'm sure you can pick it up. बच्चे समझ पा रहे हैं, बच्चे समझने की कोशिश करें. Okay, so we are going below upwards. So from below we are going upward. We don't have these names. वो name सब anatomy में होता है. Clinically तो देख के पहचानना पड़ता है बेटा. Okay, so at the level of pons and cerebellum, we saw the fourth ventricle. But when we reach the midbrain, now you can see the aqueduct of Sylvius. That is called as the aqueduct of Sylvius. Brilliant, brilliant, beta, brilliant, very good. I guess you're so intelligent. I'm so happy with you. Okay, बच्चे now please see. But can you see? Okay, just see and answer. बच्चे देखना. This is the area of the diencephalon, or we can say thalamus. I'm saying a broad word thalamus here. मतलब actually when we say diencephalon, it has thalamus, hypothalamus, subthalamic nucleus, so many things are there. So I'm saying just a broad term. Maybe this is the inferior part of the diencephalon. We can call it hypothalamus. This is the area of hypothalamus. Okay. Can you see the midbrain is giving rise to these two cerebral peduncles which are connecting the mesencephalon with the diencephalon. Are you clear with this or not? Are you able to see this here or not? कि भाई देखो ये जो थैलेमस वाला भाग है वो डायनसेफ्लॉन बनाता है, जो मिड ब्रेन वाला पार्ट है वो mesencephalon होता है. So you can see the cerebral peduncles are a connection between the mesencephalon and the diencephalon there. So this is why we call them peduncle. जोड़ रहे हैं वो. Cerebral peduncle is trying to join the mesencephalon with the diencephalon, and in the diencephalon you can see a midline slit-like CSF cavity which is called as the third ventricle. बच्चे समझ पा रहे हैं? बच्चे देखो at the level of, बच्चे अगर मैं एकदम बेसिक पे चला जाऊं, एकदम बेसिक पे है ना, एकदम if I go to the bare minimum that you need to know as a MBBS graduate, hind brain is called as rhombencephalon beta. मिड ब्रेन इज कॉल्ड एज मीजेंसेफ्लॉन. ठीक है, फिर हमारा होता है डायनसेफ्लॉन, और जो सेरिब्रल हेमिस्फीयर होते हैं वो होते हैं टेलेंसेफ्लॉन. बच्चे याद है? सो द कैविटी दैट वी सी इन हाइंड ब्रेन इज द फोर्थ वेंट्रिकल. In the midbrain, we saw the aqueduct. In the diencephalon, you will see the third ventricle. Telencephalon में lateral ventricle होते हैं. Okay. आर यू क्लियर? बिकॉज आई वॉन्ट यू टू बी क्लियर. बच्चे देखो ना, आप तो कब से थर्ड वेंट्रिकल बना रहे थे? जब वो इंटरपेडंकुलर फॉसा को ही आपने थर्ड वेंट्रिकल बना दिया था, जब थैलामस ही नहीं था. आर यू क्लियर और नॉट? वी नीड टू बी इन द डायनसेफ्लॉन टू कॉल इट द थर्ड वेंट्रिकल ना. आर यू क्लियर और नॉट? Okay, so I'm coming back. बच्चे, I can see most of you are so smart, है ना? आप तो बहुत ही होशियार हैं बच्चे, देख के बताएंगे. So can you see now? I'm trying to put a broad word here like T. T is the, any part of the thalamus. I'm saying actually it is the hypothalamus. Thalamus थोड़ा सा ऊपर होगा. Okay, so the slit-like CSF space which is bounded by diencephalon on either side is called as the third ventricle. Everybody understands? Okay, I've repeated multiple times already. ये जो 3 नंबर लिखा मैंने बेटा, that is the third ventricle. On either side you have the diencephalon. Okay, now once you're clear बेटा, है ना? थोड़ा सा एनाटॉमी को पढ़ेंगे, न्यूरो एनाटॉमी पढ़ेंगे, न्यूरोसर्जन ऐसे ही बन जाएंगे. So many children come to me and say, sir, I want to become a neurosurgeon. मैं कहता हूँ बेटा, अपना इंटरेस्ट तो जगह, ऐसे थोड़ी ऑपरेट करेगा कि कुछ पता ही नहीं क्या खोल रहा है ना. Let's get excited about it. Okay, let's see an answer बच्चे. So please see. These are your anterior horns of the lateral ventricle. Anterior horns of the lateral ventricle. And in the midline, you can see the third ventricle. Okay. Now, my question to you is this, beta. Let's see, any one of you can answer this. 2019 NEET PG, they marked on a CT brain these two structures and they asked, what is the structure marked? ठीक है, आपने बताना है बेटा. बच्चे सोच के बताना, एक बार बता दिया ना तो बात बन जाएगी बेटा. ओके, आई विल मार्क अ स्ट्रक्चर. रोम्बेनसेफ्लॉन में बेटा फरहान फोर्थ वेंट्रिकल होता है. रोम्बेन मतलब हाइंड ब्रेन में बेटा पॉन्स, मेडुला, सेरिबेलम आएगा, वहां पे फोर्थ वेंट्रिकल होगा. और टेलेनसेफ्लॉन में लैटरल वेंट्रिकल होंगे बच्चे. आर यू क्लियर आदित्य? वेरी गुड बेटा, वेरी गुड. ओके, now anybody of you can tell me what is this green colored structure marked which was asked in NEET PG 2019. This was the same image which was there in the exam. Any one of you can tell me here? ये exam में image था बेटा, बताओ. So these are your anterior columns of fornix. Okay, these are your anterior columns of fornix. Okay, do you remember fornix क्या होता है? Fornix are those bundles of white matter fibers which are connecting the hippocampus. इधर पे हिपोकैम्पस, इधर दो हिपोकैम्पस है ना, किस तरफ इस तरफ. हिपोकैम्पस को दोनों तरफ से फॉर्निक्स आ रहा है. And you remember, from hippocampus you have those fimbriae giving rise to the crura of fornix. Then you have the column of fornix. फिर वो दो कॉलम बनेंगे, बॉडी कॉलम, और वो जाके मेमोलरी बॉडी से जुड़ जाएंगे. So fornix is connecting the hippocampus to the mammillary body. Fornix is connecting the hippocampus to the mammillary body, and this is how it looks like on a CT scan. These are the anterior columns of fornix. है ना? और आपने देखा होगा, sometimes they ask what is fornix. Fornix is a mixture of commissural and projection fibers. इसमें commissural fibers भी हैं और projection fibers भी हैं. ये आपके सामने जो दिख रहा है ये fornix है. Okay बेटा, now just give me 1 second and try to understand बेटा, है ना, समझने की कोशिश करेंगे. If this is your, everybody try to understand. याद नहीं करना बेटा, याद तो कर लिया बेटा, बहुत कुछ नहीं हो रहा उससे, समझते हैं. These are your lateral ventricles. This is your third ventricle. Okay, दोनों तरफ पे from the lateral ventricle there is a foramen which is connecting the lateral ventricle to the third ventricle. There is a foramen which is connecting the lateral ventricle to the third ventricle, and this foramen is located just behind the fornix. We call this foramen as foramen of Monro. किसी बच्चे को याद है foramen of Monro? Yes, foramen of Monro lateral और third ventricle को जोड़ता है. Okay, foramen of Monro is connecting the lateral ventricle to the third ventricle, and it is located anteriorly just behind the fornix. It is located. Very good. I can see most of you are able to answer all this. Very good. Okay, so this is the level of anatomy that I wanted to build up for you. Just brain का anatomy खत्म करने के बाद we'll take a break, but just make sure that we understand the anatomy in one go. Frontal lobe, temporal lobe, sylvian fissure, lateral ventricle, third ventricle, fornix. Okay, If somebody wants to take a picture, this is the picture we need to be taking. Okay, frontal lobe आगे, सिल्वियन फिशर उसके पीछे, टेम्पोरल लोब उसके पीछे, ऑक्सीपिटल लोब सबसे पीछे, थोड़ा सा सेरिबेलम का सुपीरियर पार्ट we can still see. We can see the third ventricle, the lateral ventricles, and the fornix in the middle. हाँ बच्चे अभी मैं आऊंगा Mimansa, yes, that is a good point, and that is the thing that you picked up, and I'll show you after this image. Okay, I will show you what you have asked. Beta, good question that you asked, good observation. Okay, but before I show you the abnormality, the key is in learning the basics, key is in learning the normal. बच्चे नॉर्मली नहीं सीखेंगे तो कब कब करेंगे, है ना? सीधा कंसल्टेंट थोड़ी बनेंगे ना. वी नीड टू अंडरस्टैंड. ओके, लिसन टू मी बेटा, लिसन टू मी. एनी वन ऑफ यू कैन टेल मी what part of the brain, what part of your cerebral cortex is hidden below the sylvian fissure? Cerebral cortex ka the foramen of Monro is posterior to fornix, beta. Dr. B, it is posterior to fornix. Okay, what part of your cerebral cortex, what gray matter is located deep to the sylvian fissure? Beta बताएं, sylvian fissure के deep में कौन है? उसका नाम है insula. Okay, are you clear? The insula, or the island of Rheal that you might have studied in your anatomy. So insula is the area which is located deep to the sylvian fissure. Very good. I can see, most of you are very, very intelligent, and you just needed me to give you an idea on how the things are. Once you're clear, now we are reaching to the most important section. This is the most often asked section in any MBBS exam, any post and postgraduate entrance, any USMLE exam. Most important section, beta. Most important, beta. Okay? In the front, you have the frontal lobe. Okay, in the front, you have the frontal lobe. In the medial part of the frontal lobe, can you see this gyrus here? I'm increasing the size. Clear? बच्चे देख पा रहे हैं? Can you see? आपने देखा बच्चे, you saw the frontal lobe. I am showing you medial part of the frontal lobe. I am showing you a sulcus, है ना? वहां पे एक sulcus है, उसका और उसका एक gyrus है, एक उठा हुआ part है. There is a gyrus there. You just need to name that gyrus. Are you able to see? Are you able to see this? Can you see in the medial part of the frontal lobe, you have a gyrus which is marked with the yellow color for you, that is called as the cingulate gyrus. Okay, that is called as the cingulate gyrus. You can still see the falx cerebri anterior to it. You can still see the falx cerebri anterior to it. Okay, एंड यहां पे मिड लाइन में कोई ब्लड वेसल होगी, बच्चे कुछ सोच के बता सकता है? व्हाट ब्लड वेसल डू यू थिंक विल यू सी एंटीरियरली इन द इंटरहेमिस्फेरिक फिशर? यहां पे कौन सी आर्टरी हो सकती है बेटा? कोई गेस करके बताएगा. विच ब्लड वेसल डू यू थिंक विल बी देयर? दैट इज वेयर यू हैव द एंटीरियर सेरेब्रल आर्टरी. सो इफ यू हैव सब फेल्साइन हर्निएशन ऑफ ब्रेन, यानी फाक्स के नीचे से अगर ब्रेन हर्निएट करेगा तो कौन सा स्ट्रक्चर हर्निएट होगा? सिंगुलेट गायरस. क्या कंप्रेस होगा? एंटीरियर सेरेब्रल आर्टरी विल गेट कंप्रेस्ड. आर यू क्लियर और शुड आई रिपीट? मैं दोबारा बोल रहा हूं. सो इन अंकल हर्निएशन, नाउ यू कैन अंडरस्टैंड द आर्टरी विच वाज कंप्रेस्ड इन अंकल हर्निएशन वाज PCA. But in subfalcine herniation, if the brain is herniating below the falx because of some disease, it is the cingulate gyrus which will herniate and it will compress the anterior cerebral artery. Very good, very intelligent students, brilliant. है ना? बच्चे देखो, है ना? You can still see, okay? You can still see a part of the sylvian fissure. I will say this is the temporal lobe and this is the occipital lobe. Very good. I can see most of you are very intelligent. You can see the frontal lobe, temporal lobe, and you can see the occipital lobe. Now comes the most important part, and I want all your attention here, beta. है ना? Attention चाहिए मुझे. Whatever I will teach you, I am telling you, it will stay with you for your life. We are not doing only for MCQs. कभी भी CT ब्रेन आप देखोगे, वो आप मैंने जो पढ़ा है उसी से आपके बेसिक्स बनेंगे. ओके, just have attention. बेटा बीच बीच में मत डेविएट कीजिए. This is your anterior horn of the lateral ventricle. बीच में जो है वो septum pellucidum है. anterior horns of the lateral ventricle, and this is your posterior horn of the lateral ventricle. In the midline you have the third ventricle. Should I repeat? मैं दोबारा कह रहा हूं, बच्चे देखो. You can see the lateral ventricle now. Lateral ventricle का एक anterior part है, एक posterior part है बेटा. So you can see the anterior part and the posterior part. Anterior horn, posterior horn. Inferior horn याद है ना? Inferior horn was in the temporal lobe. You can see the anterior horn, the posterior horn. And in between, you can see I have marked the structure 3, which is the third ventricle. I have marked the third ventricle. Okay? बच्चे देखो. Okay, I'll come to the disease later on, but can any one of you identify the structure now? Okay. Identify the structure marked in the yellow color in the image and tell me the blood supply of it. ये कौन है और इसकी blood supply किससे आती है? So can you see on either side of the third ventricle, I have outlined a yellow colored structure for you. So third ventricle के दोनों तरफ कौन होगा बेटा? कौन हो सकता है? हमने guess किया था ना? Third ventricle should be bounded by thalamus. This is the area of thalamus. But can you answer what is the blood supply of thalamus? Anybody? What is the artery which gives blood supply to the thalamus? थैलेमस की ब्लड सप्लाई किससे आती है? बच्चे देखो ना, आप तो सोच रहे थे कि एनाटॉमी यू नो एंड यू आर कमिंग टू द क्लास टू लर्न रेडियोलॉजी. आई एम टेलिंग यू यू डू नॉट नो एनाटॉमी. वी नीड टू नो क्लिनिकल एनाटॉमी, अदरवाइज रेडियोलॉजी कैसे बनेगी? सो रिमेंबर, थैलेमस इज सप्लाइड बाय द पोस्टीरियर सेरेब्रल आर्टरी. कैन यू सी नाउ हाउ मेनी ऑफ यू आर कंफ्यूज्ड? कैन यू सी इट हियर? है ना, बच्चे देख रहे हैं कि नहीं? आपको पता है लेकिन सच में नहीं पता है. एंड दैट इज वेयर वी नीड टू स्पेंड टाइम इन अंडरस्टैंडिंग. बेटा मैं बताऊंगा धीरे, आपको लगे तेज जाओ तेज जाओ. हम लोग नहीं, मेरे से सुन. ओके, थैलेमस इज अ पार्ट ऑफ डायनसेफ्लॉन ऑन आइदर साइड ऑफ द थर्ड वेंट्रिकल. इट इज सप्लाइड बाय पीसीए. एक और चीज जो मैंने पीसीए से सप्लाई की थी, दैट वाज मिड ब्रेन. मिड ब्रेन वाज आल्सो सप्लाइड बाय पीसीए. वेरी गुड बेटा, वेरी गुड, वेरी इंटेलिजेंट स्टूडेंट्स. नाउ कैन यू नेम अ स्ट्रक्चर which is located adjoining the lateral ventricle? Can you name a structure which is located adjoining the lateral ventricle? कौन सा स्ट्रक्चर ऐसा है जो lateral ventricle के साथ में है? उसका नाम है caudate nucleus. Okay, and it has a head, it has a body, and it has a tail. So the part that you see adjoining the frontal horn is the head of caudate nucleus. Adjoining the occipital horn is the tail of caudate nucleus. ये आपके सामने caudate nucleus है बेटा. Okay, caudate nucleus. Okay, now caudate nucleus is supplied by, the arterial supply is by ACA. Caudate nucleus. So yellow was thalamus or green wala is caudate nucleus beta. Yellow is thalamus arpit beta, hai na? Okay, are you clear? So now try and understand. You will be able to understand something that they taught you in anatomy. Yahan pe thi beta, if you remember, the anterior cerebral artery. So the ACA should supply this part of the brain. ACA ko idhar pe blood supply honi chahiye thi, hai na? Caudate ko kaise supply kar diya? So there is a branch of ACA which comes backward and supplies this area. इस तरह की branches को कहते थे recurrent artery. Remember, recurrent artery of Hubner is the largest recurrent branch which goes and supplies the caudate nucleus. Anybody remembers this? So the ACA, it has to supply the anterior part of the brain, but there is a recurrent branches which go and supply the caudate nucleus and the anterior limb of the internal capsule. ये इस तरह से आ रही होती है. You might have studied in your anatomy recurrent artery of Hubner करके बताया होगा. Okay, so area marked as 3 was the third ventricle. बेटा third ventricle था वो, है ना? Are you clear? Okay. So the posterior part of the brain is supplied by the PCA, including the thalamus. Anterior part is supplied by the ACA. अब जो बच गया सारा, ये सब होता है हमारा MCA टेरिटरी. Are you clear now? I'm just trying to give you an idea on the blood supply so that बाद में time कम लगे. So are you clear with this or not? So the ACA is supplying this area. Okay, PCA is supplying the occipital lobe and the thalamus and the midbrain, and rest of it is the MCA territory. ऐसे होता है ना जब हम रेडियोलॉजी में हम, you must have seen ना, hospital you come and show me a CT, I say this is a MCA territory, infarct, ACA, PCA. कैसे पता चलेगा ना बेटा? This is how we think of it. Okay, now let's see an answer बेटा. I will give you some numbers and you have to answer बेटा. Name the area marked as number 1. Name the area marked as number 1. So area marked as number 1 is the caudate nucleus, and the disease in which the caudate nucleus is atrophied is called as Huntington's chorea. So you remember, caudate nucleus atrophy is seen in an autosomal dominant condition called as Huntington's chorea. Okay, 1 is caudate nucleus, 2 is thalamus. Okay, so if this was the area of the caudate nucleus, I only want you to tell me, कोई भी बच्चा मुझे बताए, behind the caudate, okay, behind the caudate, we have a similar looking area just behind the caudate with some striations inside. थोड़ा सा ऐसे line होता है ऐसा, connections हैं, lines हैं. कौन है ये? What is this area? Anyone can tell me. What is the area behind the caudate nucleus? Okay, head, बेटा हुबनर्स आर्टरी हेड को करेगी ना, टेल तो बेटा बहुत दूर है, वहां थोड़ी आएगा, है ना? क्लियर कि नहीं? सो आर यू क्लियर और नॉट? दिस इज कॉल्ड एज पुटामेन. ये कॉर्डेट था और ये पुटामेन, और क्योंकि दोनों जुड़े हुए हैं फंक्शनली तो उसको जोड़ के स्ट्राइटम भी कहते थे, स्ट्राइटम. सो ये द कॉर्डेट, behind it you have the putamen. Medial to the putamen you have an area called as globus pallidus. Medial to the putamen you have an area called as globus pallidus. Clear? Very good बच्चे, शाबाश. और ये था येलो वाला, कौन सा था जो मैंने बनाया था? थैलामस. अब नाउ आई वांट सम ऑफ यू टू क्विकली आंसर. जल्दी जल्दी बताना है. What is this between? ये क्या स्ट्रक्चर होता है बेटा? What is the structure which is between the caudate, the lentiform nucleus and the thalamus? इनके बीच में कौन है? इनके बीच में इंटरनल कैप्सूल है. इनके बीच में इंटरनल कैप्सूल होता है. आर यू अवेयर ऑफ दिस ऑल? ये सब पता था ना? सो द caudate nucleus, और इधर पे है लेंटिफॉर्म न्यूक्लियस, बीच में इधर थैलामस, बीच में जो ये सब वाई के जैसे जा रहा है, दैट इज द इंटरनल कैप्सूल. वेरी गुड, ब्रिलियंट. सो इंटरनल कैप्सूल हैज अ anterior limb, a bend which is called as genu, posterior limb, and you have a retrolentiform part also. So this is how it looks like. Okay, very good. I can see you can understand. So what happens in the exam is, exam ऐसे होता है बेटा, देखना आप में से कोई बताए तो, है ना? आप में से कोई बताए तो. 1 is caudate nucleus, 2 is thalamus, 3 is lentiform nucleus. Name the structure between them. Okay, just give me 1 second. I'm getting a phone call repeatedly. Just give me 1 second. Okay, so let's be back here. So now I want you to see that the dotted line represents the internal capsule, and this was asked, this image that you see now has been asked in your NEET exam in the past, to identify the structure which is between 1, 2 and 3, that is your internal capsule. Now I want to come to a question that a lot of students were asking. बच्चे सोच के बताना है ना? A lot of students were asking, what do you think is this? ये white सा क्या दिख रहा है? This is not normal. I can see there is a lot of asymmetry. What could this be? हाँ, globus pallidus and putamen together is called as lentiform nucleus. शाबाश बेटा. Okay, anybody? Anybody can answer now. Let's see if you can answer. Anybody? Anybody? What is this hyperdense thing, white thing? So in CT, if I see a structure which is more white than brain, I will call it hyperdense. Okay. Now see, this hyperdense area that you see here is a blood clot, or we will call it hematoma. Okay. I want you to go back to the beginning of my class. I told you on a Hounsfield scale, brain has a Hounsfield number of 20 to 40. Hematoma is 60 to 70. So hematoma will be more white than the brain parenchyma. This is brain hemorrhage. Are you clear with this? This is brain hemorrhage. Okay. And it is appearing more white. If it is appearing more white, we will use a word in my CT report, hyperdense. Okay. I want you to answer. Let's see if any of you can answer this question. Why is the brain hemorrhage hyperdense? Because in a blood clot, hemoglobin, especially the globulin part, becomes tightly packed, and that causes increase in attenuation, and that leads to brain hemorrhage being hyperdense. Let me explain. Okay, let me explain to you. Okay, बच्चे दोबारा से देखो, है ना? बच्चे देखो, आपने कहा ब्रेन हेमरेज हाइपरडेंस है, मैं पूछ रहा हूँ क्यों हाइपरडेंस है? Because it is a blood clot. Whenever you will have blood clot, the RBCs will come closer to each other. RBC जब पास आएंगे, when they come closer to each other, the hemoglobin also will come close to each other. And hemoglobin has a protein called as globulin. वहां पे बहुत सारे इलेक्ट्रॉन है क्योंकि प्रोटीन में बहुत इलेक्ट्रॉन्स हैं. So those electrons will cause increase in electron density, and that area will become hyperdense. Okay, so do you understand this, the why behind it? है ना बच्चे, अगर why नहीं पता होगा ना, you will never understand anything. So why is the brain hemorrhage hyperdense? The reason brain hemorrhage is hyperdense is because the hematoma has tightly packed RBCs, and it has a protein called as globulin. The globulin has electrons, and the electron density causes increase in the density on a CT scan. Are you clear? Now, where is the hemorrhage located? Is it located in the caudate nucleus? No. Thalamus? No. It is located in the putamen. This hemorrhage is located in the putamen. Are you clear with this or not? Now, what is the blood supply of putamen? Now, let us understand a little bit here. Suppose this is your internal carotid artery. Suppose this is your internal carotid artery. This internal carotid artery gives rise to two branches, MCA, ACA. Internal carotid artery, MCA, ACA. Remember this or not? Yes, yes. From MCA, from the middle cerebral artery, there are some superior lenticulostriate branches which are going to supply the basal ganglia, which is going to supply the area of putamen. Okay. This is also popularly called as the Charcot's artery. Okay. Now this is where my heart is. Okay. I want everybody to see with me. बेटा सभी बच्चे देखेंगे. I want everybody to see with me. बेटा ट्यूमर करेंगे ना, अभी ट्यूमर में क्यों जा रहा है, अभी वहां पहुंचे हैं, अभी तो सिर्फ एनाटॉमी का लोकलाइजेशन दिखा रहा हूं. इट इज नॉट ड्यू टू कैल्सिफिकेशन. व्हाई पुटामेन? ओके, लिसन टू मी. व्हाई पुटामेन स्पेसिफिकली? देखो, प्लीज सी, this is the area which is supplied by the Charcot's artery. Now what happens is, if you have high blood pressure, अगर आपको hypertension है, तो you'll read the same thing written in Robbins also, even in Goljan also. If you have high blood pressure, this pressure will go into the internal carotid artery, go into the MCA, go into the lenticulostriate branches. Now these branches normally do not receive such high pressure, but in hypertensive patients, they are exposed to high blood pressure. And because of that high blood pressure, these arteries undergo lipohydinosis. Because of repeated exposure to high blood pressure, they undergo degeneration, and that they rupture, the Charcot's artery ruptures and leads to hemorrhage in the putamen. And that is why putamen is the most common site of hypertensive bleed in the brain. because it is due to rupture of the Charcot's artery that you studied in anatomy but you never understood. Okay, you remember there or not? बच्चे मैं कह रहा हूं रटे जाएंगे तो क्या मजा आएगा. Let's try to understand ना, समझते हैं बेटा, है ना? Okay, everybody understands that middle cerebral artery has these lenticustrial branches which are superior to it, which are going and supplying the putamen. In high blood pressure, these arteries undergo lipohydrolysis, and that is what is called as Charcot artery, and if it ruptures, it causes putaminal bleed. Most common site of hypertensive bleed in the brain is putamen. Putamen is the site where you have hypertensive bleed. Now I want you to understand and answer a logical question, beta. सभी बच्चे एक logical question बताएंगे. I am drawing a circle here. ठीक है बेटा, सोच के बताना है. If somebody is hypertensive, okay, किसी को hypertension है बच्चे, सोच के बताना है. If somebody is hypertensive, so the brain hemorrhage that he has, अगर उसको brain में hemorrhage होता है, will it be inside the circle or outside the circle? बताओ और क्यों? ओके, सोच के बताना है. अगर किसी को हाइपरटेंशन के कारण ब्रेन हेमरेज होता है, if somebody has a brain hemorrhage because of hypertension, will it be inside the circle that I have drawn or outside? The answer is inside. Why? बताओ क्यों? Because the pressure is coming from the heart into the carotid arteries into the circle of Willis. तो प्रेशर सेंटर में ज्यादा है, it is more in the center and it is reducing when I am reaching to the periphery. So it is unlikely that a hypertensive patient would have a bleed in the lobes, frontal lobe, parietal lobe, temporal lobe. ऐसा lobe में bleed होना hypertension के कारण uncommon है, because a hypertensive bleed will be mostly central. Are you clear here or not? So with this I am taking you to a AIMS level question. बच्चे AIMS level question पे आ रहे हैं. बेटा कोई भी बता दे. A 70-year-old man has a lobar hematoma on CT scan. It's written in Harrison, it is written in Bailey and Love, it is written in Robbins, but nobody knows it. Let's see if you can answer. Okay, has a lobar hematoma on a CT scan, he is not a known hypertensive patient. What is the most likely cause in this patient of brain hemorrhage? Let's see if you can answer. But we already know that brain hypertensive bleed is unlikely to be present as a lobar hematoma, है ना? अब वो कह रहे लोबार ब्लीड है. ओके, वो कह रहे लोबार हेमेटोमा, लोब में, फ्रंटल लोब में, टेम्पोरल लोब में ब्लीड है. 70-year-old आदमी है, क्या कारण होगा? एनीबडी कैन टेल मी दिस आंसर एंड देन यू कैन टेक अ एम सीट, है ना बच्चे? देखो सोच के बताना है. हाँ, एनीबडी? Now, some of you are saying aneurysm. But it's not aneurysm. Aneurysm will cause subarachnoid bleed, जो मैं बाद में सिखाऊंगा. ये parenchymal bleed है बेटा, ये subarachnoid नहीं है, ये brain parenchyma में लोब में hemorrhage है. This is where we think of amyloid angiopathy. पढ़ा था कुछ old लोगों में, you have amyloid beta deposit in the blood vessel which makes it weak, and amyloid angiopathy is the cause of lobar hematoma in old people where you do not have any, you know. And did I say trauma? मैंने बोला ही नहीं चोट लगी है, ऐसे कैसे बोल दिया आपने, है ना? Do you understand this one? It's not traumatic. Old आदमी है, लोबार bleed हुआ, you have to think of amyloid angiopathy. Some of you are able to answer this. Very good. Amyloid beta deposit. Yes, very good. So this is how you think. Okay. Once you learn to think, it becomes easy. Now let's see one more image. बेटा एक और image देखेंगे and फिर we take a break after that. Okay. This is your falx cerebri, frontal lobe, parietal lobe, occipital lobe, lateral ventricles. Frontal lobe, parietal, बेटा वो ट्रिवियल ट्रॉमा वाला ना, वो ब्रेन के बाहर वाला ब्लीड होता है बेटा, वो सबड्यूरल एक्स्ट्रा ड्यूरल सिखाऊंगा मैं, अभी वेट करना बेटा. ये ब्रेन के अंदर पैरेंकाइमल ब्लीड के कारण मैंने आपको बताया बेटा, है ना? देखिए एनीबडी कैन आंसर. Frontal lobe, parietal lobe, occipital lobe, and these are the lateral ventricles. The arrow is marked at the falx cerebri. Okay. Okay. Now, so if you notice, in the sections before it, we were always able to see the Sylvian fissure. If I was able to see the Sylvian fissure, I was calling it as temporal lobe. Behind the Sylvian fissure, temporal lobe. जहां सिल्वियन फिशर खत्म हो गया, where Sylvian Fisher has ended, now I am calling it as parietal lobe. Okay, now I'm calling it as parietal lobe. Okay, बच्चे please see, are you clear with this or not? यहाँ पे है हमारा, anybody can guess यहाँ पे कौन होगा बेटा? What do you think is this yellow structure that I'm drawing connecting the two hemispheres? That is your corpus callosum. That is your corpus callosum. Are you clear with this? So that is your corpus callosum. That is where you find the corpus callosum. Once you get the idea, frontal lobe, parietal lobe, lateral ventricles, and anterior and posterior to it, you can see the corpus callosum. Anterior part of the corpus callosum is the genu. Posterior part is also called as the splenium. Are you aware of all this? Yes, some of you are able to answer. Very good. Now, before we go for the much awaited break, just understand one small diagram with me. Developmentally, corpus callosum develops like this. Okay. You have these white matter bundles called as bundles of Probst. On either side of the interhemispheric fissure, in the fetal life, you have bundles of Probst. These are white matter bundles, and the lateral ventricle are parallel to each other. Later on, these bundle of Probst, they migrate and they start connecting the two hemispheres. That is called as the corpus callosum, and the lateral ventricles, they come closer to each other like this. Are you clear with this or not? Now suppose you have any fetal insult during this period. इस समय पे बच्चे को कोई इश्कीमिया हो गया ब्रेन में या इन्फेक्शन हो गई, you have a fetal insult, this migration will not happen. So if the migration of the bundles of Probst does not happen and the corpus callosum does not form, we will call it agenesis of corpus callosum. So then we'll call it agenesis of corpus callosum. Now, if there is agenesis of corpus callosum, the lateral ventricles will be parallel to each other because there is bundle of Probst in between, so they will be parallel to each other, separated by the bundles of Probst. Okay, are you clear with this? So when we see the patients with agenesis of corpus callosum, you will find that the lateral ventricles will appear parallel to each other, and in between there will be space because of the bundles of Probst. Now, when the foreign people saw that, they thought maybe this is some space here, and this is one tire. This is one tire, this is one tire, this is one tire. And this is what is popularly called as the racing car appearance. Okay, should I repeat? Are you okay with this? This is slightly complicated, but I think interesting to note. है ना? Do you understand this? कि भाई embryological fetal life में corpus callosum बनता है. Initially you have bundles of Probst, then they migrate to form the corpus callosum. In between, if you have a fetal insult, the lateral ventricle will remain parallel to each other, and that is called as the racing car configuration. Are you clear? Are you clear with this? Yes? Okay, everybody is able to understand. So this is how the normal should be. The normal should be like this. Lateral ventricle should be closer to each other like this, and you should have the corpus callosum around it. Everybody clear? Okay. Okay, everybody understands. So we announced the schedule, I think, multiple times. Even I had shared everywhere, and I think your coordinators, everybody had shared multiple times. Huh? Now, are you clear with this or not? So this is how I have given you an overview of how the brain looks like and how to look at the CT of the brain. Now we will take a quick break. I would suggest if you can take a 15 minutes break and you come back, then I will show you some diseases. Because so far my focus was on normal anatomy. So I was trying to vertically integrate your anatomy in clinics. Now I will show you how radiology and diseases they are integrated in surgery and in hemorrhages and strokes. I will show you all that. So please be back in 15 minutes, okay? And we will not go with the time. I think we will be exceeding the time. थोड़ा आगे तक पढ़ेंगे क्योंकि जब तक आगे पढ़ेंगे तभी हम पूरा समझ पाएंगे, ना. आई डोंट वांट टू रश एनीथिंग, है ना. मैं चाहता हूँ आराम से पढ़ेंगे, क्लास में सब समझेंगे, है ना. So the key here is I want to make sure that we understand in the class. बेटा याद थोड़ी करना है ना, समझना है. Okay, so please be back in 15 minutes. So we will start the class at 6:10 p.m. and probably we will go till around 8:30 odd. We will go till 8:30 odd. That's okay, I think. Yeah? Okay, thank you very much. Okay, so please be back at 6.